Hello and welcome to Fireline. I'm Bill Wade, a captain with Tampa Fire Rescue. The nature of fire service was changed forever when paramedic-staffed station wagons officially began operating in July 1973. Ever since then, Tampa Fire Department has become the leading provider of EMS for the city. Recently, the department's name was changed to reflect the amount of EMS work that it does. Now known as Tampa Fire Rescue, this department responded to over 57,000 calls last year, 46,000 of which were medical in nature. Each piece of fire apparatus has dual certified firefighter EMTs. When an emergency request for medical assistance reaches the Tampa Fire Rescue Dispatch Center, one of the 11 Tampa Fire Rescue units, and the closest available fire truck or ladder truck is sent to the alarm. The objective is to get medically trained persons on the scene as quickly as possible to assess the patient and render care. In Tampa, the medical assistance begins before the first fire truck or paramedic unit even arrives. The Fire Dispatch Center has personnel trained in Emergency Medical Dispatch, EMD. This system has the 911 dispatcher ask the caller a series of questions to determine several basic items. First, they determine what type of emergency exists. This is important so that the right type of help can be sent. The EMD dispatcher asks some medical background about the patient. This information is relayed to the responding paramedics. Then, if it is a severe medical condition, such as a patient that is not breathing or a woman delivering a baby, the EMD dispatcher can provide pre-arrival instructions so that the caller can assist the patient. This system of emergency medical dispatch allows Tampa Fire Rescue to better utilize its limited resources and empowers the caller by giving them the information necessary to help the injured or sick person. Here to tell us how emergency medical dispatch works is Margaret Hamrick, a supervisor and trainer with Fire Dispatch, and also Myra Riggio from Tampa Fire Dispatch Center, a dispatcher. Thanks for being with us today. Hello, how are we doing? Good. Margaret, why don't we start with you? What is the job of fire EMS dispatch? What do you do up there?
Well, our main objective is to get someone to the scene as fast as possible. We want to get our eyes and our ears on scene so we can evaluate the situation and transport and take care of the patient. The dispatchers have to be very familiar with the city. They have to know the responding territory for the engines and rescues, and that helps them better determine who's going to be the closest unit.
Sounds like a pretty responsible job, getting all those resources out quickly. Now, Myra, you've been a dispatcher how long now?
Just over almost a year and a half.
What got you interested in being a dispatcher? Has it been a good choice for you?
It's been an excellent choice. It's very rewarding. I have a great time doing my job. What interested me is that I've always been wanting to do some type of work in the EMS field. I've always worked in somewhere in the medical field and went through some training as an emergency medical technician, decided this would be the place for me, helping people and getting the help to them that they need.
No, that's very good. Margaret, when people call 911 for an ambulance, the dispatchers nowadays don't just send an ambulance, they start asking a whole bunch of questions, and probably the one question I would say, doesn't this delay the paramedics getting out the door and going to help somebody, this series of questions you ask?
No, it doesn't, because as soon as the dispatcher can determine what type of a response is going to be needed, we hit a dispatch button on the computer and it automatically sends it to the fire station. The station gets a printout and all the information on there is provided to them. So even though we're continuing questioning the caller, the units can already be responding.
And I understand the questioning doesn't take that long of a period of time.
It takes from anywhere from 45 seconds to a minute and a half that we can determine what type of a response is necessary and get the units responding. And we're usually off the phone within a minute and a half.
That's pretty reasonable. Myra, now you understand you all are trained somehow to help the citizen and help the caller and stuff like that. We mentioned that in the opening little speech and all. How does that work? It's not just a guesswork type thing. I understand you have some type of flip charts that you brought along here.
That's correct. We do have this advanced medical priority dispatch protocol that we use at the outset when we are employed and started doing our jobs as 911 dispatchers. We're trained to use this protocol, and throughout the time that we're working as dispatchers, we are continuing to get more education, more training. We do provide or rather not provide, but I can't think of the word.
For the caller?
No, we participate.
Participate.
There you go. In different types of training and different types of continuing education programs that enable us to use this to the best that we can to help the caller.
Okay, well let's just for the heck of it, now we shot some videotape up at dispatch, seeing how some of the dispatchers work. Let's you and I do a little role playing.
Okay.
What do you say? Okay,
Sure.
I'll call in. I'll be the caller, and I've just called 911, and you've answered the phone. Okay, I've just called it. Help! My father's sick. Oh my gosh.
Well identified, Tampa Fire Rescue. What is the address of the emergency? It's the first thing we want to know. So.
Okay, so I give you like 808 Zack Street or something.
And the phone number in case we're cut off.
Okay.
We need to know a phone number.
274-7000.
Okay. At that point, we want to determine what the problem is. There's a series of questions that these are called key questions. We were going to go through this series first to determine what the problem is. And we'll get the address, the phone number, and the problem. At that point, we want to know if there's multiple people that are hurt. For example, in a car accident, how old the patient is or are, if they are conscious, if they are breathing, and whether they're male or female.
Let's go ahead and, like I said, I'll be the caller, and while we're doing this, the people will be seeing some tape from the dispatch center, and let's go through this. Okay, I've just called. Okay, so I've just called. We'll start this. Hello, help! Is this the paramedics?
This is Tampa Fire Rescue. What is the address of your emergency?
808 Zack Street.
And the phone number you're calling from?
274-7000.
All right, sir. What's the problem?
It's my father. He's having some really bad chest pain.
All right. How old is your father, sir?
He's 65.
Okay. Is he
wishes.
Okay. Is he conscious at this time?
Yes. Yeah. He's sitting here talking to me.
And is he breathing?
Yes, he is.
At that point, I've determined, you've told me he has chest pains. There is a card designated for chest pain problems. I'm going to proceed to the questioning there. First question is he alert, able to talk to you?
He's talking to me, yes.
Is he sweaty or changing color?
A little bit. He doesn't look good at all.
Okay, a little bit sweaty or changing color?
Okay, something specific. He's a little bit sweaty, but his color's okay.
Okay, does he have a history of heart problems?
Yeah, he takes some heart pills. I don't know what it's about, though.
And is he breathing normally?
He looks to be breathing okay.
Okay, and finally, you've told me he is on medications. What medications is he on?
I don't know. I'd have to ask him.
Okay, what I need you to do right now, I then proceed to some instructions for the caller. I need you to allow him to assume the most comfortable position for him.
You want me to lay him down or anything?
You just let him be.
Are the paramedics on the way yet?
The paramedics are on the way. We have help on the way to you. We want you to keep him as comfortable as possible. If his condition worsens in any way, we want you to call us immediately on 911. We'll give you further instructions. And while you're waiting for the paramedics to arrive, I need you to get medications, a doctor's name and phone number out for them so that they have that when they arrive.
All right. Well, very good. That was interesting. Hopefully our viewers learned something from it. And I understand people do start rushing you a little bit. It's help on the way.
Yes, they don't understand the reasoning behind our questioning, and they don't expect it. But that's what they should be expecting when they call 911. And they won't. It won't always be the same questioning. Each problem is different, but there will be questions to be asked.
My goodness. Margaret, you brought along some videotape for us to watch that explains emergency medical dispatch and goes over some situations that happen nationally, explains maybe why Tampa Fire Rescue has got involved with emergency medical dispatch. So we'll go ahead and watch that tape at this time. They'll come back and we'll discuss from the national overview while we're doing it here locally.
Okay. Expect to dial 911 with a medical emergency and have the dispatcher tell us what to do until paramedics arrive. But cover story reporter Jerry Anders explains why 8 out of 10 911 dispatchers refuse to provide instructions that can and have saved lives.
It's the kind of real-life drama you may have seen on TV.
What's the problem? Peter drowned. My dog's drowned.
A child drowns, a frantic mother dials 911, and a calm, professional dispatcher provides the kind of life-saving information needed to pull that child back from the brink of death.
I want you to tip the head up just slightly. Now, I want